Hello, my name is Durab Nasrazad, and today my presentation is on muscular dystrophy. So in this class
So far, we've seen many different sorts of conditions and disorders that affect one's body, which limits them from participating in exercise or making daily life generally more difficult. And muscular dystrophy is one of them. So in this graphic, we can see on this person that on one side of their arm, we see the muscles normal, they're healthy, size looks fine, and on the other that is affected by muscular dystrophy, we see it smaller, it looks weaker, and that's what muscular dystrophy does. So muscular dystrophy is a group of neuromuscular diseases that are caused by mutations in one's genes. MD weakens the muscles, which in turn causes a decrease in mobility. There are 9
different types of muscular dystrophy. They each have their own variation and severity, and we see that the most common type is Duchenne muscular dystrophy and Becker muscular dystrophy. In Duchenne muscular dystrophy, we see the protein called dystrophin is altered, which leads to muscle degeneration and weakness. And about 1 in every 3,500 to 6,500 males that are born have DMD. So the types of muscular dystrophy include the following. We have Becker, which is similar to Duchenne, but a little more mild. We have congenital, which does shorten the lifespan and is pretty severe, but is not as common. And as I mentioned earlier, we have Duchenne, which is mainly seen in men and progresses slowly. It's the most common type. Then we have distal, which is a low severity and progresses very slowly. We have Emery-Dreifuss, which progresses slowly as well and affects the strength in the shoulders, upper arms, and shins. Then we have facioscapulohumeral, which causes muscle weakness. Limb-girdle, which is hip and shoulder muscles, usually are affected first within this one. We have myotonic, which causes the difficulty to relax muscles, common in adults. And we have oculopharyngeal, which affects the muscles in the face, which could cause droopiness, almost similar to how you would look after a stroke. So in this graphic, we can see that Duchenne is the most common type. It begins when you're very young. Then with Becker, it appears when you're young, but it can appear later in your teen years. It progresses slower than DMD, and then variation like limb-girdle, we see that it can start in adulthood as well as childhood. So the effects of muscular dystrophy include many different things. As I mentioned, muscle weakness earlier. There's also, you can experience difficulty walking or running. You can start to waddle as you lose mobility in your legs and strength, which cause you to waddle. You can have trouble swallowing. Heart problems can come, like arrhythmia, cardiomyopathy. It can also cause learning disabilities. You can also get scoliosis. Muscle pain is pretty common for those with muscular dystrophy. You can also have trouble breathing if you have muscular dystrophy. And we see that your joints can be stiff and loose with MD. And in this graphic, we see an example that many people who do have muscular dystrophy need to use a wheelchair or a walker to assist them to walk, as it's not easy without one. So the diagnosis of muscular dystrophy includes different sorts of tests. One would include blood tests, where we see measurements of the levels of different, we see serum creatine kinase, serum aldolase, and myoglobin, and they run blood tests to see if these levels are elevated, and if they are, it can be an indication of muscular dystrophy. There are also going to be muscle biopsies done, which is a removal of muscle tissue, then it is examined. Then there's genetic testing. You see DNA analysis to to see if someone does have muscular dystrophy. And some other tests can include neurological, heart, exercise, and imaging tests. So treatment and medication, we see that there is no cure for muscular dystrophy as of right now, but there are ways to make it less severe. A great example is physical therapy, as with strengthening your weakened muscles, you can prevent muscle loss and mobility loss. And a main medication taken by those who have muscular dystrophy would include corticosteroids, which are prescribed and they can prevent loss in strength, but they also can increase blood pressure. So, the effects of muscular dystrophy on exercise. So, MD directly affects the muscles and it causes loss of muscle mass and strength. So, with high intensity exercise, it can prove to be an issue for those with MD, as if it's intensive, it can damage muscles and become irreparable, as these muscles are already under so much stress from the disease. And we also see that when mobility is limited and those who are confined to a wheelchair or need to use a walker, they're going to need to have a different sort of exercise, as they can't participate in some other ones. So exercise can affect muscular dystrophy in many ways. Firstly, it needs to be done properly, as if it is done incorrectly, it can cause damage to the person. But for people who do it properly, we see improvements in overall fitness and health for those with MD, just like anyone else. And exercise at a higher intensity can't be done for most people with MD, especially DMD, as the muscles struggle to repair. And we want to see exercise done at a low to moderate intensity, which would be beneficial for those who are cleared to do so, and this exercise can counteract loss of strength due to DMD. So in my case study, my patient is a male client that is 54 years old. His risk stratification, he has difficulty in movement and has been dealing with DMD for a few years. Goals: improve upon health and overall strength. Consideration: he's taking corticosteroids to manage his DMD. So, firstly, for exercise testing, once he is cleared to do so, we will do a cardiorespiratory fitness test, which would include either the 6-minute walk test or the 6-minute cycle ergometer test, whichever one the client is able to perform. We also have a muscular fitness test, which would be using the hand dynamometer to test strength, and we also do a flexibility test, like the sit and reach test. And the reasoning behind all these choices are that all of these are easy to perform and low intensity. So we wouldn't have to worry about the client hurting themselves, becoming sore, or any sort of issue. So my exercise prescription, for aerobic fitness, I would prescribe them for low impact exercise, such as being in the pool, walking, taking dance class, or cycling, and have them perform this for 1 to 2 days a week, with the goal to move up to 2 to 3 days a week. Intensity should be set lightly to begin with, and progress to moderate intensity. And for time, we should have them start off with 10 minutes a day for each session, and as they move forward, aim towards 30 to 60 minutes a session. That would be most ideal. For resistance training, we'll have them perform this 2 to 3 days a week, with 48 hours between each session. For strength work, we'll have them work at 40 to 80% of 1RM, with an increase towards 60 to 80% of 1RM for strength. If the client wishes to work for muscular endurance, we can do so by using 50% of 1RM instead. And we could start off at 4 to 5 reps at 4 to 5 sets, 4 to 5 reps to 8 to 12 reps, increasing from 1 to 2 to 4 sets per group of muscles. and also include a rest time of between 2 to 3 minutes between each set. And resistance workouts should include using your body weight for squats, lunges, using bands for side steps. Then we can use dumbbells at a proper weight, and machines can be used as well. And for flexibility training, we'll have the client do 2 to 3 days a week of this, of stretching to the point of slight discomfort, and with a hold of 10 to 30 seconds. We can include static stretches for major muscle tendon groups, and dynamic stretches may be incorporated as well. These stretches can include squats, any sort of dynamic stretch that they wish to do. And a takeaway message from this would be that while muscular dystrophy can really limit someone's life, they should not exclude exercise from their daily life, as it can be is beneficial to them for their overall health and well-being, but also towards their muscular dystrophy. And by doing so with the client, we would definitely see an increase in their health, their overall fitness, and it would definitely be something beneficial for them to do on a daily basis. And that is all. These are my references. Thank you very much.